Nadezhda Women's Health Hospital is a leading medical institution in Sofia, the capital city of Bulgaria, that offers world-quality medical care for the whole family. In its 8 years of history, Nadezhda Hospital has been continuously growing to meet its patients' needs, from conception through pregnancy and birth through to old age. The hospital features a fertility clinic, obstetrics and gynecology ward, unit for maternal-fetal medicine, maternity and neonatology wards, surgery ward, medical imaging unit, ICU, a medical oncology clinic, as well as 8 state-of-the-art labs. For 8 years, more than 50,000 patients have been served by our team, and more than 15,000 babies were born. The IVF clinic of Nadezhda Hospital is the jewel in the crown. The largest in the country, it sees more than 5,000 IVF cycles per year, and the average success rate is 40%, higher than the rest of Europe. In patients under 30, the clinical pregnancy rate is 45%, and the take-home baby rate is 41%. Success rates for patients aged 30 to 39 are 39% for clinical pregnancies and 35% for live births. In women over 39, the clinical pregnancy rate after IVF is 25%, resulting in 19% live births. More than 500 international couples seek fertility treatment at the hospital every year. The hospital team keeps up with modern research in the field of reproductive medicine.
For the first time in Bulgaria, we introduced our novel method for assessment of the implantation window, which does not rely on genetic testing. The implantation window is the period during which the endometrium covering the inside of the uterus is ready for the embryo implantation. As a result, we perform quicker testing and hundreds of successful IVF cycles in couples with recurring implantation failure.
Nadezhda Hospital has its own program for IVF with donor eggs and sperm. In Bulgaria, gamete donation is anonymous and strictly monitored by the competent authorities. The success rate of egg donor IVF cycles at the hospital is very high. The cumulative success rate after up to 3 embryo transfers is over 70%.
Our practice shows that male and female factors are equally present in couples with fertility issues. In the andrology sector, we apply all modern treatment modalities, medical as well as surgical. In our vast experience, we have had cases of patients with azoospermia where we were able to retrieve no more than 5 living spermatozoa through testicular biopsy. Nevertheless, following ICSI fertilization, the couples had healthy babies.
Nadezhda Hospital has an ISO-certified high-tech cryobank for long-term storage of sperm, oocytes and embryos. The clinic offers fertility preservation options for patients with cancer and autoimmune and rheumatoid diseases. Gynecologists with top qualifications and expertise perform reproductive surgery, including office hysteroscopy, hysteroscopy and laparoscopy. All our fertility consultants are also skilled gynecological surgeons experienced in fertility-saving techniques. This is a huge advantage because if your case requires surgical treatment, you won't have to be referred to a third-party provider, but will be taken care of by your treating specialist. We have a long record of successful minimally invasive treatment of all uterine pathologies, including endometriosis. We are innovators with a modern approach. We are Nadezhda Hospital, because Nadezhda means hope, and when faith meets hope, life will find a way. We don't treat you like a case, we treat you like family.